Hi everyone, this is Dr. Korous, and we are in second episode of Tea Time with Dr. K, and we have sweet Kathy here today. I'm super excited because she vibed with my energy, and she is so much fun. So welcome to our second episode with us, and I really appreciate it. I know you came from work.
Well, thank you so much for having me here today. This is an honor to be here as your second guest. I mean, it's a privilege, but
Thank you.
But I'm so excited to be here. This is my happy place. I love being here.
Oh my God, that was not the story a few years back, right?
No, it was not, but that quickly changed.
So
yes,
would you like to tell our audience your journey of going to dental offices and how you came about to meet us and how you were anxious and how we changed that anxiety to something you just called a place of fun?
Anxious was a mild term with how crazy scary it was going to the dentist for me my whole life.
Oh my
I've
gosh.
had very, very bad experiences as a whole child, young adult, and unfortunately carried on to my son, my youngest son, because he has bad teeth like his mother, unfortunately. And when we
you talk about Devin, right?
Devin.
Devin was on the phone. Yeah, I know, right?
But we found you by my oldest son, actually, just by his experience there. And I found out you were here, and I work right up the street. And the first day we came in, we've never not been back. So here we are. And that was maybe, 3 years now?
3 years ago, yeah.
And lots of visits later, and I'm still smiling and laughing, and big teeth, happy teeth. Right here, happy teeth. Big smiles.
We still need a lot of work that we still get work.
Yes, we do.
And can you tell our audience what have you gotten done so far? And we're still in progress to get more work done for you, because I think, as a mother, she wanted to make sure her son is taken care of.
Absolutely.
And so before we get to that, to Devin, tell us what kind of work you have had done so far. And then I'm going to also tell you guys what we're planning to do for her more.
All right. Well, gosh, I've had crowns done.
Same day crowns.
Same day crowns. I've had veneers. I've had an implant.
Yeah.
I've had fillings. I've had repairs. I've had numerous cracked teeth repaired and filled.
Yeah.
And
how do you feel now?
My journey. It's been an amazing journey. It's been a learning experience of learning how to take care of my teeth after, learning how to floss better.
The basics. That's right.
Flossing and taking care of just basic things. But it has been a world of a difference since we've met you.
Oh, thank you so much.
It's our lives have changed tremendously, and I really am not just saying that, but it has been a game changer for us, because before we stepped in this door, I mean, I literally would be in tears going to the dentist, and my son would. You try not to have your child play on that too, but he knows you're scared, and he's scared. So,
because they're just
but it was just so emotional. I mean, it was a very emotional experience to do that.
Yeah.
Oh, I get.
Oh my gosh, you have a little tissue here.
It's all good. It's all good. I'm good.
But every time,
but it was such it's just amazing though. I mean, I'm smiling ear to ear. My son smiles ear to ear because our teeth were so bad before. Yeah, thank you. I think I'll be okay. I get a little worked up because it is, I mean, people don't realize when you've had your whole life, you don't want to smile, and you're afraid of people seeing your broken teeth, or you're afraid of people seeing discoloration
or judging you.
Yeah. And I think that's just one of the type things that people deal with all the time.
Yeah.
And they're afraid to come to dentist. And I honestly have to tell you from personal experience, just never be afraid. Come see Dr. Korous.
Because that's not what we do here. We make you feel welcome.
Absolutely.
And we don't judge you at all.
Absolutely.
It doesn't matter, what race, nationality, background, or how many teeth you have, you don't have. We treat you like family. And we are here to help you throughout the journey. And again, with us, you said 3 years ago. And, with us, it's important. We set up a plan. And if it takes us 6 months, then it takes us 6 months. If it takes us 3 years, 4 years, then so be it. And so with you, we've had a lot of work that needed to be done.
Oh, we still have a lot to do too.
Yeah.
So it's just,
we still have more implants and appliances for sleep apnea. Exactly. And so you've been patient with us, and we've been patient with you.
Yes, you have.
So
you've never pressured me. You've never felt like I couldn't do it. You never felt me feel like, anything but positive.
Yeah.
It's just
Thank
always
you.
been good vibes, always good vibes here.
I appreciate that.
And my whole family comes here. My husband and my 2 sons.
And you want to tell a little bit about Devin experience? I know.
Well, that's when I get a little worked up and when I get emotional because Devin's something in my family line. We have hereditarily bad teeth on mom's side of the family. And unfortunately, my youngest son and I have the worst. My oldest son and my husband, their teeth are good. But ours are just horrendous. Not anymore, but they were.
Yes,
they were.
Before.
But when we came in, it was very, Deb and I were sitting on these 2 chairs right here, just sitting and very nervous and very just, oh my gosh, what we're going to experience. Because we've had other dentists be like, you need to have thousands and thousands of dollars done, and you need to have this, and we don't know if we're going to be able to help you. We don't know what we're going to be able to do. And we were very nervous. We didn't know. We're like, okay, we're going to come here and get a second opinion because my son is only 23 at the time.
Yeah.
Maybe a little younger at that time. And he had a whole mouth that needed to be done, everything. And we knew. And when we just were here, we're like, okay, well, we sat here and we were talking and we were admiring the beautiful office and we were taking pictures of each other and doing selfies. And
you told me to take a picture of your shoes.
We took pictures of our shoes on this beautiful floor and we were laughing. We're like, okay, this is going to be the place. This is it. We are going to do it. We're going to do it. And when you saw Devin, and I'm sure you probably were like, oh my gosh, this poor guy's mouth, this poor kid's mouth, because everything was bad. And it was just like, and you're dealing with a teenage boy that over the years, you're like, Devin, did you brush your teeth? Devin, did you doing your things? And he's 17 years old, 18 years old. You're like, you can't physically be in their mouth with them. But you're like, yes, mom. Yeah, mom, I did it. And you're realizing that he's really not taking care of his teeth properly. I didn't know how to handle it because I'm trying to handle my own teeth and we're both scared.
Right.
So, and when we came here together, Sid and I was holding his hand. I mean, with my 20-year-old son, 23-year-old son at the time, whatever he was. And I'm like, Devin, we got this. We're going to do it together.
Yeah.
And we've never looked back. So, and he just said to you tonight, he
was on the phone because she knew that he knew that you're going to be on the podcast with me.
Yes. And he goes, you have changed my life.
I know.
He goes, do you remember when I was so happy and I cried in your arms?
I know. He said that.
Cried. And he actually cried here, you guys. He cried.
And I held him and I just like,
he said, I can actually smile again. I could smile.
And guess what happened afterwards? You came and told me.
He got a girlfriend like right away. He had the confidence to ask his girlfriend out that he's with now still. Yeah. That he had the confidence to ask someone out.
Because he didn't have the confidence before to ask her out because of his teeth. And he had the veneers done. He had a lot of crowns done. He had extractions and stuff. And the reason we can talk about this, Devin has allowed us to talk about it. He's been on social media about this. So, and I did tell him when he was on the phone, I said, Devin, you're going to be on my podcast one day. And of course, when he's coming in town, I'm going to make sure that he's going to be in town on our podcast as well. So he had a lot of work done, and his teeth are beautiful now.
We can go back to episode 2.
Yeah, we can go back to episode 2.
Here's Devin, and he's so proud of, he smiles, he beams. He smiles all the time, like a big, like pumpkin smile, like a big, goofy smiles because he's so happy.
Because the very first time he came here, he was very sad, like not smiling at all.
He didn't smile much.
He didn't much. And
only
then
in private.
Yeah, and then all of a sudden, the moment he walks into the office, and he even met his friend too, like he's smiling, he fills up the whole room with happiness, and he's just full of energy.
He comes in, he's joking and laughing, and
That's amazing though. That's great. That's actually what brings about the confidence and the smile that he's having right now.
Yes.
Positive talk.
I get in the chair and I'm like, okay, let's do it.
I know.
But when I first came in, I was terrified.
Yeah.
Terrified. And that you guys, everyone here has been so nice and patient.
Thank you.
And just so understanding.
And initially, the thing is that we understand because we have over, 50-60% of our patients have dental anxiety, and we understand. Mm-hmm. We see it. I have had patients sit on a chair. I hit the dentist, and I looked at them and I said, what is it that I can do to make you feel better? And I don't take it personally. And it's just like, okay, they have gone through experience, and I have to be patient enough, loving enough, understanding enough. So as the rest of my team, as you can see from the first phone call from Suzanne, to come to either any one of my assistants, Devin, Suzanne, Jasmine, Angela, whatever. They all have an understanding of these patients have had some different experiences.
Yes.
And we're just going to make it better for them. And we're going to be sitting here and listening to what their needs are and make sure they're comfortable. And when you come and sit on the chair, like you were here yesterday, you got some work done yesterday, and you're sitting here chilling and nothing happened. And may I say what you got done yesterday?
Yes, of course.
She had a filling done yesterday, and also a same day crown where we mill the crown in the office. You want to tell them the story and how, like, what we do in the office as far as same day crown?
Same day crowns is amazing because there's so many other places that previous dentists, it would take like 2 weeks to get your crown to come in. You'd have to have some temporary, and then just hope when it did get in that it was going to fit right. It wasn't going to be
correct.
You could take months to get a crown done. And this was like a matter of hours. I was here quite a long time, but I had a lot done. I did have 2 teeth worked on and cleaning.
Yeah.
And
actually you had an onlay. I said a filling, but it's actually you had a partial crown and a full crown.
Mm-hmm.
And that's what you had done, right? And then
2 teeth right next to each other.
2 teeth right next to each other. And the way the process works is that we remove the cavity and we digitally scan and design the tooth in front of the patient, right? You saw that in front of the patient. Mm-hmm. And then it goes into the milling.
Very cool stuff.
Yeah, very cool stuff. We pick the shade of the teeth with like a porcelain block, and then we put it in a milling machine, and it comes out in a purple stage. And we tried it in a purple stage in your mouth, make sure it fits good. I had to make some adjustments. And then we'll put it in the oven where it crystallizes and come out like a tooth color shape, and it's already bonded to your tooth the same day.
Yeah, it's amazing. Yeah. It's an amazing procedure. And it's just, but I sit here and I relax, and I have to tell you.
Tell me.
I think you had a couple consultations I heard you doing, and just brings back those memories of you're just so calm and relaxing with people.
Thank
and
you.
I sit here and I hear what's going on in the office. I hear the laughing. I hear
the laughing Dr. Chris down the hallway. You can hear it.
I hear the calm atmosphere though, and you don't feel afraid. But the time before I was here, you had a full house, very busy, but this one gentleman was here. He was scared to death, and I scared to death, and I felt that from a room over.
Yeah.
The wave of fear this poor man had, and you were telling him very calmly, like, listen, we need to do this. We're gonna be okay, and whatever you were saying. Yeah. But that poor gentleman was so scared, and whatever it was, you got it done. You got him through it, but it took a long time.
Yeah.
And I was sitting there, and I think I told you, I'm like, listen, I'll come back because it was something I was doing, and it's like, and I told one of the ladies, I said, just let Dr. Korous deal with that person.
Oh, that's very sweet of you.
Because I was in his shoes.
Yes.
And he was terrified.
But I remember you being patient with us and saying, it's okay, I'm gonna let you take care of that patient so that he would have his time with me.
Right. And
yeah. Because usually we do take emergency patient the same day, and if they never had experience with us before, or whatever, or they need a tooth, taken out the same day, they're usually scared, but they haven't had a chance to get to know me, to know that I will take my time with them.
That just goes to show that it doesn't matter how old you are.
Yeah.
That dentistry it's a scary thing to the average person, to anyone. Teeth just are very scary because we don't know what's going on. We're not dentists.
Yeah.
And so
until someone changes your experience.
Yes. And you have always explained to me what you're doing. You've explained to me in detail what's going on. Even when we've come with hiccups in the road where you're like, oh, okay, that wasn't supposed to happen. We're going to have to do this route. And, because nothing is 100% when you can open a tooth up.
You're like, okay, what's happening with this tooth? We thought we could save the tooth, and all of a sudden the tooth is no longer savable. And then here are the options we have now. Like whether it be, an implant or a bridge or a partial, depending on what is going to be best fitting with your mouth and your life situation and circumstances, even financial too. That's when we make the decision as well, right? We give all the options, and of course, one of the options is no treatment. But obviously, when you come to see me, you want to be able to get something done so that things don't get worse over time. And some people get scared, and they're the first time seeing me, and they need to get the work done, and it's me having to carry them through that journey.
the whole conversation we're having right now in this whole episode of what we'll call it is the care and the understanding of the patients.
Thank you so much.
And we like I said, we can't thank you enough.
But thank you.
But just what we try to is a family of coming in, of just being like a bunch of scaredy cats that have turned completely to like, okay.
Nash feels comfortable talking on the episode about it.
Like I'm coming and no fear.
Oh, that's very awesome.
And that was not the case 3 years ago. And my whole life.
Yeah.
I mean, my whole life, it was just being afraid even from a child.
And the truth is, Kathy, we treat our patients like my own family. And I feel that.
Truly.
And I don't have any kids, but even when the kids come into the office, we had a patient today. Like Dad was asking about the tongue release because we're doing the kids expansion, and then the kids are a little apprehensive about what's going to happen, and I had to explain the process to them and to say that to not worry about it. And I said, and when the kids come to my practice, they're like my kids, and I protect them like my kids.
Right.
When adults come to my practice, they're like my brother and sister. So however I treat you guys is like however I treat my own family members. So I want you to make sure that you feel comfortable when you sit in that chair.
Oh, absolutely.
And that's why I feel like from the very first time I met you to like the second appointment to the third appointment, everything got easier and easier over time.
It did. And it was scary. It was scary. I'm like, it took some time. I had some big work done. So did Devin. We had big major things done.
Exactly.
I was terrified with an implant.
Yeah.
But,
she has an implant in the front too.
I was like, oh my gosh.
That was easy.
Yeah, like I could do anything.
Yeah, that's right.
I truly felt like that. So I was like, oh my gosh. An implant just is such
like a big idea in here.
The word implant is scary in itself.
It's funny she said that I could do anything. You said I did an implant, can do anything. That's true, because if that was the biggest obstacle in your head to get it done, and then you got it done, how was the experience? Did you feel pain during the procedure when I was doing the implant?
I did not.
There was no pain.
I did not. The only pain was my own pain of being scared.
And then afterwards, when I told you it was done, how did you feel?
I was just like, oh my gosh, it was great.
Yeah.
You're pain free. Yeah. You're good.
I just say don't do anything hard.
Yeah. But it was like, you're right. I am okay.
Oh yeah.
I'm fine. I'm okay.
Yeah.
And it's just that little kindness, reassurance. But that just was just Devin and I thought that was just the cutest thing to have things. You're having major work done. Okay, let's be real, people. Okay, you're small and things are being done. You're just comfortable. Right. You're happy. You're comfortable. Right. You're okay.
And
you're comforted. And that's really, you're just like, okay. Yeah. It was just but you're like, you're okay, Kathy. You just need to relax now. We're getting things made and everything. But it was such an experience that was amazing.
Thank you.
Absolutely recommend.
Thank you.
100,000%.
Thank you so much. Yeah. And we want to make sure the patient knows that, first of all, when you get the work done, I don't want you to be sitting in here. Yes, you're waiting for the crown to be milled or for the implants. You want to make sure that afterwards you are fine. Mm-hmm. It's not like you have to stop eating or living life. You can just go on your normal day. If it's going to be same day crown, patient usually ask me, "Oh, can I go eat?" And I said, "Yeah, and we're actually going to get you something to eat right now, whether it be from Chick-fil-A or whether it be from a smoothie. We always provide just like
it's just something you never would
experience
anywhere else." And I'm like, and that just sets you apart from many other reasons that set you apart.
Thank you.
I'm saying this truly out of my heart.
Thank you.
It's different when you feel you could come here. And I have had things break. I've had my teeth break unexpectedly. I've called you. You've always gotten me right in.
Yeah. And the truth of the matter is Suzanne and everybody in the office knows, if a patient calls with an emergency, we do see them the same day. We don't push them in the next day unless it's that we can all see on Monday. But other than that, we try to see our patient the very same day for the dental emergency. And interesting enough, when you talked about the food situation, even when I was not having my own practice, I was an associate somewhere else. I actually had the same practice, you guys. If the patient sat on my chair and I knew they're going to be here for a little while, they wouldn't know, but I would share my lunch with them, or I would tell one of my assistants to go get something or pick up something, because I feel like the patient that sit there, they're not going to tell you they're hungry. They're not going to tell you that they want something to eat. and more importantly, I don't want my patient to, feel nauseous or pass out on a chair. So I usually provided either a juice or a smoothie or a little food or fruit or something, so that they can, like, just like us, we get hungry, like the patient gets hungry, especially if they're going to be there for a few hours. So the same practice, when I opened my practice back in December of 2016, I carried out. The whole purpose of me having the same day crown in the office was to change the patient experience so that they'll go home and, you know, come back with several weeks later with temporaries or gooey impression and stuff. I decided to do a digital scanner so that that experience of having the gagging reflex goes away, the sensitivity with the temporaries, and also the experience of them having either lunch or breakfast or a smoothie, whatever it makes you guys feel comfortable in on the chair to be able to drink or consume, so that you're not necessarily starving the few hours that you're at the practice. So that has been my model ever since, even when I graduated from dental school, which is 11 years ago. Wow, that's been a long time. 11 years I've been a dentist. Wow, that's pretty interesting. That sounded like, back in 2013. But even in past December 2016, my model has been the same. You know, if a patient that sits in the practice, you know, for a same-day crown or even for long surgeries or long full mouth rehab, we do provide them breakfast or lunch, depending on their comfortable level of what they can eat.
Of course.
Of what they can eat.
Obviously, yeah. You know,
that's what we ask. Would you like to see the menu? And then we show the menu. Would you like Chick-fil-A or would you like the smoothie?
This is what we could do today.
Yeah.
But it is a different perspective, like how you're looking as the dentist.
Yeah.
And as the patient, I would say customer, but patient, and not customer, but a patient of looking at comfort level going, I'm okay. I'm okay. I'm eating something. I'm drinking something.
See, I didn't know that.
And
how you
how we
perceive
look at it. We look at it in the chair. You're going, okay, I got this. I'm okay, because I am drinking a smoothie.
No, which is amazing, Kathy. Thank you for saying that.
Because we look at it as going,
yeah,
we're okay.
The fact that you said it, that I can eat and I'm okay. It's okay to eat. That I didn't know it had that kind of an effect on someone like you, and you mentioned it.
Yes.
Who knows how many people feel the same way?
You're like going, because you're. I said the word terrified a few times, but I really don't know how else to explain. Dentist.
Yeah.
It's terrifying because you just don't know what's happened to you.
Yeah.
And you don't know.
And then we give you this comfort.
At the mercy of you have my 100% trust, but you don't know what you're going to find. You don't know what you're going to say. You're waiting for the bad news.
Yeah.
You're waiting for worse. You're waiting for worse. And that's been my experience, not everyone else, but my experience. It was never good. It was always something more. It was always something else.
Yeah.
It was always something else.
And then we changed it.
But that's that relief feeling of going, okay, I'm good. Good now. I'm good.
Yeah.
I'm good. And just that little thing has gone a long way. I mean, it may be for you to hear it from a
No, it's really nice. And you know what? Now that you said that, you know how many patients are like, you're saying that I'm okay to eat or drink, but I just didn't see it that to them, which to you guys, it's another level of comfort.
Our point of view.
Yeah, it's another level of comfort saying that it's okay, which is really amazing. So thank you for sharing that. I just didn't know how I was making the patient feel so much better knowing that they can eat while they're in the dental chair.
Because I'll tell you real quickly, when Devin had his teeth pulled, because Devin would be here for a very long time too.
Because he had a lot of work done. Yeah.
And he had a break, and he called me because I knew I was right here. Yeah. And he's trying to be the big kid, he's 20. He's like, I don't want to call his mom. Be like, oh my gosh, this is, so much going on. But he's just like, oh yeah, I'm fine. Dr. K's getting me some Chick-fil-A. Just a Chick-fil-A sandwich is heaven anyways.
Yeah, exactly.
And he will never forget that. And he's told, I can't tell you how many people he's told that he was eating Chick-fil-A with his dentist.
Which is pretty cool.
But to him, that's that level of comfort.
Because we want the patient to feel like that. And it's okay.
And he felt so reassured. It was a comfort level that was from like here to here.
Yeah.
Of knowing that I got here.
Yeah. And not only that, I think because we had a lot of work done for him, and then we made him temporaries. And he was eating the Chick-fil-A in his temporaries in his mouth, which was great because I said, you can eat with these. It's not a problem. You can go home with these.
And his point of view was like, oh my gosh, I have these temporaries in my mouth that I'm eating.
And it's going to be fine.
But also with his case, I'm not hurting. Yeah. I don't have broken teeth. I don't have all this bad stuff in my mouth that we just cleaned out.
Exactly.
Yeah. So I know you never really realized that, but that made a big
Big difference. Well, thank you so much, Kathy. You are amazing.
For having me here today, because I will talk to you any day of the week, anytime.
You're so sweet. Thank you so much for sharing your heartfelt story of your journey. Thank you for letting me take care of you and your entire family the past few years. And Devin, I can't wait for him to be on my show.
He will be back.
One of those days that he's in town, I would want him to come here for sure.
The very first thing he just said on the phone today when we were talking before we were prepping for here, he goes, "Tell Dr. Korous I'm coming. I'm coming in." I said, "Okay."
We did good.
We did awesome. Yeah. And I can tell you, twice today I got complimented on my teeth today.
You know what? Because your energy, your vibration, like you're at a different level because you're happy from within. And especially whenever you have the cavities and stuff out of your mouth, it makes your body, your blood even healthier.
And now I'm just ear to ear smile. I smile all the
time. I'm so happy for you.
I do.
And I can't wait to make sure as the years go by to be able to add implants and the rest of your teeth added.
We will.
And it's a journey. I appreciate you. Thank you so much.
Thank you for having me.
Of course, guys, stay tuned for our next episode, which is going to be coming in next week. And we will have more patients, coming and sharing their life story and journey with me and how they found us and their dental journey with our practice and how they overcome their fear and anxiety, just like Kathy, and how she was able to bring her own family and the rest of her son and her husband here as well.
Yes. And as someone who is such a scaredy cat as me, if I can do it, you can do it. I promise you.
Thank you so much. Any recommendations for them? For the audience? Should they come and see us?
Do it. Call. Do all in the morning. If you're afraid and you've been holding back and you think you just can't get things done, you can. You can, absolutely.
Thank you so much, you guys. Have a wonderful rest of your day and stay tuned for more episodes to come on Tea Time with Dr. K.
Thank you.
Thank you.